Assalamualaikum warahmatullahi wabarakatuh and good day everyone. So we meet again for the third chapter on osteoporosis. Okay, before we have discussed regarding the overall of this chapter, okay, we have go through the physiology, okay, type of the bone and some type of definition, and a little bit we did touch on the treatment. So this is the third video in which we go a detail on treatments, okay, for the osteoporosis. Okay, without further ado, we will proceed for the next slide. Okay, so let me change. Okay, this is already red. Okay, this is the next slide. Okay, so overall, this is a few treatment that we go through, right? We do have biphosphonates, okay, raloxifene, calcitonin, teriparatide, and calcium salts. Okay, these are I would say that total is 4 that we're going to discuss today. Okay, this is the pharmacological treatment for treatment disorder on bone remodeling, osteoporosis, Paget disease, and bone metastasis. Okay, and hyperglycemia of malignancy. Right, these are 4 type of diseases that can be used on these these 4 general class for the treatment. Okay, so this is the overview how it look like. All right, this is the bones. Okay, this is the bone. Okay, this is a few. The red one is the type of treatment that we can use. Plus, this indicator like helping, induce, okay, to produce better, all right, or to promote. Okay, that's the word, to promote. While the negative mean to prevent, all right. So you can see that, for example, this one, calcitriol, actually promote for recruitment of osteoclast. All right, so here we need to understand what is osteoclast and what is osteoblast. Okay, so the osteoclast is referring to the cell that responsible to reabsorb bones. Okay, while osteoblast is the cell that responsible to create new bone. Okay, to synthesize the bones. Alright, so this is the overall. This is PTH, parathyroid hormones. Okay, these are well known among of the reason to control calcium ions on the serum level, which is in the blood. Okay, so one of the way they increase amount of calcium in the blood is by bone reabsorption. Okay, okay, so this is teriparatide. Okay, estrogen and raloxifene, this is the sum that we will look into. All right, biphosphonate and glucocorticoid. Okay, so for this one we will focus on biphosphate, teriparatide, and estrogen or SERM. All right, so from here, biphosphate, raloxifene, this is the main agent to actually inhibit osteoclast activity, while teriparatide is one of the drug that help to promote synthesis of the new cell. Okay, so among of the unit of this mentioned three is biphosphonate, which is the block osteoclast activity and it's block the osteoclast differentiation. So from the pre-osteoclast precursor, they cause that the cell unable to differentiate to become a matured osteoclast. So when there's no matured osteoclast, the process of reabsorption can be hindered. Okay, or we say that we can be slowed down. Alright, so without further ado, let we go for the first class, which is biphosphonate. Alright, so there are several type of drugs that falls under biphosphonates. One of these are andronates, ibandronate, risendronate, zoledronic acid, etidronate, paridronate, and telodronate. Alright, one of the way it could help you to remember is that of them have a dronate. Okay, and the rest is maybe you need to remember it by alphabets. Okay, the mechanism of action, how it's work. Okay, this drug is actually induce apoptosis on osteoclast. Right? If you have not come across yet what is apoptosis and necrosis, okay, this is among of way how a cell death occur. Right? Where necrosis is what we call as forced death. Okay, when the name is forced death, which means that the death or the destroyed cell is not really well managed, okay, can cause harm to throughout the cell or the surrounding area. As compared to apoptosis, this is what we call as natural death. It's something like the cell is being destroyed from the internal factors, okay, and the death is become very properly and tidy and will not cause any much harm throughout the surrounding. Okay, this is the cell, okay, it's a G file. Okay, this is the cell, and then you can see that it become explode or what we call it apoptosis, okay, apoptosize, and it becomes small molecules, okay, within the cell, and then phagocyte will come to clean up throughout of the cell. Okay, so the mechanism is they cause apoptosis on the osteoclast, which means that the cell that responsible for reabsorption being killed, all right, in natural manner, which is apoptosis. All right. Second, it inhibits cholesterol biosynthesis pathway, which is important for osteoclast function. Without that one, the osteoclast unable to properly do its work. Besides, it is literally kill the cell via apoptosis. And lastly, it decreases the osteoclastic bone reabsorption due to inhibition of cholesterol biosynthesis. The osteoclast cannot function properly, and even a precursor of osteoclast, the matured osteoclast being instructed to kill themselves in the manner of apoptosis. So all of the reabsorption rate will be decreased, and also decrease the fracture risk on osteoclast patient. Okay. As mentioned before, this is a few type of diseases that we use for biphosphonate. One is osteoporosis, which is this today's topic. Alright, the Paget disease. Paget disease is a dullness of the bone. Okay, it's occurred throughout the way. Same thing due to osteoclast activity. Right, metastasis and hyperglycemia of malignancy. Okay, and prevent treatment for post-menopausal osteoporosis. Alright, so hyperglycemia is referring to the condition where we have a lot of calcium, okay, within the blood, right, in the circulating blood, in the serum. So this one is actually, it increase the reabsorption of calcium within the serum and depositing them. One of the place is the bone, okay, for the bone mineral. Right, all those being said, okay, there is a few known side effects for the biphosphonate. One of it is diarrhea, okay, abdominal pain, and musculoskeletal pain. Okay, this is the most common side effect of biphosphonate. Okay, so let we move to the second type of the drug. Before that, okay, so this is the schematic diagram regarding how it's work. Okay, this is biphosphonate function is that the reabsorption bone for osteoclast is being triggered to undergo for apoptosis. Okay, this is the second type of the drug, which is calcitonin. Okay, so what does calcitonin do? Okay, number one, this is the overview. Okay, it's lower the calcium ion level in the blood or within the serum. Okay, especially the one that hypercalcemia just now. Okay, and then it inhibit calcium ion absorption by the intestine. All right, so intestine unable to reabsorb a lot. Okay, it's preventing. All right. Third, they inhibit calcium ion reabsorption in the kidney. Okay, from being excreted out through the urine. So this allow it the ion to be circulated within the blood. Okay, and then within the blood, it absorb it, okay, to the body to be deposited within the bone. Okay, so what they did is that they prevent here and here. Okay, and then they lower the level here by sending it to this part, which is promote deposition of calcium ion into the bone. Okay, what we call it during the process of osteoblast. Those are the summaries, I would say. Okay, so let's move to the detail, especially on the mechanism. All right, so calcitonin, what you need to know. Number one, this is treatment for a woman who are facing osteoporosis less than 5 years. Okay, on the first category, which is postmenopausal osteoporosis. Okay, and number 2 and number 3, again the same thing, just like the biphosphate, which is hypercalcemia and Paget disease. Okay, so it's quite interesting to share. Going to share to you where this calcitonin is being extracted. Okay, this is actually being derived from a salmon. Yes, it is a fish. Okay, call it salcatinin. Alright, so the main function is actually it's relief pain associated with osteoporotic fractures, and it's available in parenteral and intranasal formulation. So this is how you're going to use that. Right, so the half-life is about 40 to 45 minutes. Then the clearance is through the kidney. Effective, okay, for hyperglycemia and Paget disease, right? Since this one, you can see the clearance here. There's some precautions if someone who have already kidney impairment, okay, a kidney failure. This is a thing that we need to put into a consideration. So how does it work? Okay, so calcitonin is actually lowering the serum calcium, okay, and the phosphate, which is inhibit osteoclastic, and later it's also inhibit osteoclastic bone reabsorption. Okay, so this is the main. I make it simple. You can read it more. Quite interesting to know all of this. Okay, and then how about their adverse side effect? Usually have something issue like the nose, okay, rhinitis and other nasal symptom. However, this is known for increasing risk of malignancy. Okay, so usually this will be the last result. Calcitonin is something just like a serum. Later on we will go through on the serum. Okay, for the sorry, not serum, SERM, SERM. Okay, very effective for this one. However, the increased risk for malignancy up to, if I'm not mistaken, up to 4.5% risk for the cancer. This is for a very long-term use. Okay. Alright, so this is the one that I mentioned to you, SERM, okay, selective estrogen receptor modulator. Alright, this is actually for estrogen replacement. They are very effective to prevent postmenopausal bone loss. Okay, it's no longer used as primary therapy because it's known for its side effects. Okay, for the and this one usually used for postmenopausal osteoporosis. Okay, not really to the age and not really to the secondary type of osteoporosis. Okay, so this particular thing is actually, this particular drug or agent is well absorbed in our GI tract, okay, gastrointestinal tract, and the half-life is 22 hours and is excreted through our feces, okay, fecal offices. One of the example of SERM is riloxifene here. This is actually a approved drug for prevention and treatment, but remember, this is no longer used as the primary type of drug. And alternative for the intolerant of biphosphonate women, okay, just one the first agent we go through is the biphosphonate. For those unable, do not have tolerance on that, this is among of the alternative. Okay, it increase the bone density without increasing risk of endometrial cancer, which is, this part is good, and stimulate osteoblasts and inhibit osteoclast. However, although this is type of cancer, but they do have an increased adenomal risk of cancer, such as endometrial cancer, okay, breast cancer, stroke, and coronary event. Okay, hot flashes, leg cramp, and peripheral edema. Okay, so this drug is, since it's known for the worst side effect, it's no longer as a primary. Okay, and then so usually we just disregard this drug if we wish to go for the long-term treatment, and when the risk is outweigh the benefit of this particular treatment. Okay, this is the other one, and let's go to the third method, which is teriparatide. Okay, this is quite interesting in my opinion because it's a combination of human thyroid hormone, okay, parathyroid hormone. It is actually administered continuously daily basis. Okay, first drug approved which stimulate bone formation, which is very nice. It stimulate. You can look here, the pictures here, how it's look, okay, how it's promote. Okay, it's actually promoting for PTH, which is stand for parathyroid hormone. Okay, receptor to produce, to make osteoclast mature and do the synthesis of the bone. Okay, so the mechanism promote bone formation by stimulating osteoblastic activities. Adverse effect, however, this particular drug has not been evaluated beyond than 2 years. We're not so sure what happened for the very long term. Okay, and then beside that, we do have a patient will face some nausea, okay, dizziness, headache, and mild hypercalcemia. Okay, this is the thing that we need to observe throughout the process. Last but not least, all right, non-pharmacological treatment. Usually we do this in a combination, but depends. Nowadays people have more option, but it will be the best based on condition and individual itself. Okay, we combine this. Number one, we have to get an adequate diet in calcium and vitamin D. You can take it either from organic food or from your dietary, or even you can get it from a supplement such as vitamins. Okay, directly vitamins for that. All right. Then do weight bearing exercise, but for the weight bearing exercise, okay, for this one, you have to do it continuously, because some paper and articles show that the moment you stop it, okay, the benefit of weight bearing is also lost. Okay, this is a proper and continuous exercise. Beside that, is also hardening or increase the bone density, as I mentioned in the part 1. All right, if you are part 2, if you are focused on that certain area, it will help strengthening the bone on that particular area. Cessation of smoking, okay, reduce intake of alcohol and caffeine. All right, so I love to talk about a little bit on caffeine, usually more on the coffee. Right, it found out that caffeine actually reduce reabsorption of calcium ion, okay, during the intake of the caffeine. However, if you are addictive or really love the coffee, some article mentioned that you can reduce that by taking milk, okay, to add up in your coffee to reduce the effect of prevention reabsorption of calcium by our body. All right, so that's all from me for this last class. Okay, if you have anything, you can ask throughout the system. You can email me, you can put in the comment, or you can put during the class activities. All right, that's all, and thank you everyone.